Cheers and tears.
Yay!
As the first Pfizer vaccines shot into Coloradans' arms this week. But amid the celebrations,
I think pharmacists tend to be really detail-oriented and they're very precise with their work.
pharmacists helped get those doses from vials into needles, ready for an arm.
That's where we immediately started noticing that there was not only overfill in the vials, but there was enough that at least one additional dose was being found in most of these vials.
Good news, says Holly Monat, Health One Director of Pharmacy Services. But they couldn't use that extra dose until the FDA said okay. Monat said with the vaccine's time and temperature sensitivities, they saved what they could of that extra, but some got tossed out in the wait.
And it was really hard to be on the receiving end of a lot of phone calls from the front lines saying, have you heard anything? Have you heard anything? And we were dialed in with a lot of different people.
They got an answer on Wednesday.
Was really excited to see the FDA come out with a statement to use that sixth dose.
Casey Dugan is the VP of Pharmacy Services at Children's Hospital Colorado.
Actually having the vaccination in hand and then being able to start this process kind of gives that glimmer of hope that this may be the beginning of the end to this pandemic, and we're all really excited for that.
So will the people who get the extra doses be guaranteed the booster second shot later?
We have considered that. So what we are operating under the assumption of is that the vials that we will get subsequent to this will contain at least a similar amount of overflow.
In a year with so much bad.
So this really was kind of a holiday bonus for me, I think.
It's a win. They are happy to celebrate.
It just makes me really happy and proud to be a part of all of this and to be able to provide vaccine to these colleagues.
Now, while the FDA said the extra dose is okay to use if it's all in there, pharmacists say you can't mix the leftovers from several different vials to create your own full level dose.